The Modified Barium Swallow Impairment Profile online training is divided into 3 zones to guide learners systematically and step by step through the 17 physiologic components and impairment scores that together comprise the standardized assessment tool. The Learning Zone is accessible to all learners upon initial login. This zone establishes the physiologic foundation of swallowing function and impairment that underpin the MBSImP. An overview and rationale for the development and implementation of the MBSImP is provided. Utilizing instructional videos and video fluoroscopic examples paired with custom swallow physiology animations, learners are systematically taught the 17 physiologic components and standardized impairment scores associated with each that together comprise the MBSImP scoring metric. The training zone provides the means to develop skill in scoring each of the 17 physiologic components. This self-guided practice offers ample opportunity to assign MBSImP impairment scores to real video fluoroscopic swallow studies and includes feedback as to scoring accuracy. The Reliability Zone assesses the learner's ability to use the MBSImP scoring metric to accurately profile physiologic swallow impairment across full protocol MBSImP swallow studies. Learners may work through the training and testing at their own pace and have an unlimited amount of time to complete the course. The training begins with the Learning Zone. As you will learn, the MBSImP is organized by 3 physiologic domains: oral, pharyngeal, and esophageal. You can navigate the domains through the selection list in the upper right corner of the screen. When a domain is selected, the associated MBSImP physiologic components are populated. Once you have viewed the component lecture, toggle to the scoring practice modules using the link in the upper left corner of the screen. The scores for each component are demonstrated using representative segments of video fluoroscopy paired with detailed animations. These example pairs were developed to enhance the clarity of the physiology being demonstrated in the original MBSImP exams retained for like training. These can be viewed, reviewed, and studied repeatedly. To toggle between the scores, use the score buttons at the bottom of the media player. The associated score definitions populate in the upper left corner of the screen. When ready, select the next component from the list to begin the narrated PowerPoint overview lecture. To assist with learning, quick access to the scoring help page is available by clicking the link along the bottom left of the media player. This page contains supplemental information to assist with training and will be covered in greater detail in later sections. Likewise, scoring tips were developed for each component and can be accessed through the link along the bottom of the media player. This file will automatically download and will reflect the component currently highlighted. Every lecture and scoring practice module for each of the 17 components must be viewed at least once before access is granted to the training zone. This zone is divided into 2 sections where you will practice scoring both single swallows and full modified barium swallow studies. The 17 physiologic components are listed next to the media window. Operation of the media player is the same as the player in the Learning Zone and includes a pause play toggle, a slider to advance and reverse the video, frame by frame and slow motion controls, and expand and collapse buttons. Based on years of field testing, we've provided hints throughout the training zone to address commonly missed scoring rules and nuances. Hover your cursor above the Hint button to reveal component-specific scoring guideline reminders. Hints will appear frequently throughout the training zone. When ready to score, choose the desired component in the list next to the media player, and the associated scores will populate to the right. Select the score of choice. Feedback is immediate and states the success of a choice and the exact frame or frames during which the score was assigned. If correct, move on to the next component. If incorrect, resources are provided for review. The View Scoring tutorial icon navigates to the scoring help page. Select the appropriate component to reveal the scoring tips document and tutorial videos. Selecting the View Score Animation icon displays the score-specific component animation from the Learning Zone in the Media Player window. Finally, the Component Scoring Tips icon will begin a download of the Component-Specific Scoring Tips PDF. Scores and progress is retained between sessions so that you can work through the training zone at your own pace, starting and stopping as needed. Each must be scored at least once, however, before access to the full studies within the training zone is granted. The full studies section is very similar to the swallow by swallow training you've just completed. In the full studies section, there are 15 high-resolution full protocol studies to score. These are accessible at the top of the screen, consistent with the swallow by swallow layout. Bolus volumes and consistencies are labeled within the study videos. If a trial is omitted for safety or technical reasons, that information is embedded within the protocol when the task would otherwise occur. Passing your cursor over the full study summary link reveals a brief medical history specific to the selected full protocol study. Likewise, hovering your cursor over the hint reveals scoring guideline reminders for certain components. The video player controls function the same as those in the swallow by swallow section and the learning zone. Choose the desired component in the list next to the media player, and the associated scores will populate to the right. Select a score, and immediate feedback regarding the success of your choice is provided. Instead of specific frames, the bolus consistency on which impairment was judged is revealed. If incorrect, the system provides the correct score and, like the swallow by swallow section, the option to view the associated help files and animations. The menu selections and resources along the bottom of the screen remain the same, and the scoring help page resources remain available. These resources facilitate guided practice, and you are encouraged to reference them frequently. Scores and your progress are retained between sessions so that you can work through at your own pace, starting and stopping as needed. In this next section, you will test your ability to successfully capture impairment using the MBSImP tool. The test is designed with 10 randomly selected studies to be scored using overall impression scoring. For the most part, working with the studies in the reliability zone is the same as in the training zone. When the scoring of all 10 studies is complete, a new window appears instructing the learner to review and edit or submit all scores for evaluation and determination of success. Once the test is submitted, the scores are returned to the system and feedback is provided regarding the number of components successfully passed with 80% accuracy. Feedback is provided for percentage accuracy of each individual component. If any components are scored below 80% accuracy, you will be prompted to retest. Functionality of the testing platform is the same for each test attempt. However, the studies themselves will be shuffled and new studies will be introduced. Components scored above 80% accuracy are retained in the system and will be grayed out on subsequent test attempts. Once a full retest of the remaining components is completed, you will be prompted to review and edit or submit the test. Once submitted, the number of components successfully passed and the percentage accuracy of each component is revealed. Once reliability is achieved, you will be provided with a link to complete a course evaluation and print your certificate of completion. Additionally, the standardized report generating templates will unlock, and they are available on the MBSImP home screen via the Join Facility Group link. The MBSImP website includes an express report feature that allows clinicians to quickly enter MBSImP scores into the database and produce an abbreviated report. To access the express report, click on the Patient Data and Reports link on the home screen. Once an ID is obtained, the patient's year of birth, race, ethnicity, referring physician, reason for referral, primary medical diagnosis, and MBSImP overall impression scores must be entered before a report can be generated. There are two options for generating a report. The first of the two reports is formatted as a PDF file that can be downloaded to your computer or tablet. Scrolling through the report, you will notice that there is a plot graph image representing the location and severity of each of the 17 MBSImP physiologic components. The plot graph image is a feature of both the full and express report generators. This image is derived directly from the information entered into the report and complements the descriptive table containing the MBSImP overall impression scores and nomenclature. Once you have reviewed the PDF file, it can be emailed, faxed, or copied and pasted into compatible electronic medical records. If your EMR does not support images, you can download a rich text format of the report that can then be pasted into the patient's medical record.